Hi guys, welcome back to the channel. Today we are discussing the biochemistry previous year question paper from 2019 to 2024 by Meditalk by Dr. Bhushan.
This video is for educational and informational purposes only. The exam patterns, formats, and tips shared are based on publicly available information, personal analysis, or experience, and are intended to help students better understand how exams may be structured. I do not represent any official examination board or institution unless explicitly stated. Exam formats and requirements may change over time. Always verify with the official website or source for the most up-to-date information. The strategies and insights shared are general in nature and may not apply to every individual's situation. Viewers are encouraged to use this information as a supplementary guide and always refer to official notifications or trusted academic advisors. By watching this video, you acknowledge that it is meant to support your learning, not replace official guidance.
First, August 2019, 3 hours, 50 marks. First essay question, explain the glycogen metabolism and its regulation. Add note on associated disorder. Part 2, short notes, lactic acidosis, explain why B12 deficiency causes microcytic anemia. How dietary lipid distributed after digestion and absorption. Phospholipid, types, function, tissue specificities, physiological relevance of glucose transporter, relevant to insulin secretion and egg. Part 3, short answer, importance of HbA1c testing, Winkel-Korsakoff syndrome, what is the effect of non-competitive inhibitor of KM and Vmax, 4, schematic representation of the electron transport chain, 5, creatinine transport, vitamin C in adult, normal condition associated with increased creatinine clearance. Write notes on respiratory acidosis first, second creatinine clearance ratio, fluorosis, 4, primary structure of protein, 5, ELISA, 6, methylation reaction, glutamine, collagen, hyponatremia, post-transcriptional modification. This is also repeated. Next, August 2020-22, paper first, define the glucogenesis, explain their 4 key reactions of glucogenesis, add a note on role of glucagon in regulation of glucogenesis. Part 2, write notes on fluid mosaic model of membrane, effect of pH and temperature on enzyme activity, regulation of cholesterol biosynthesis, name the protein involved in iron metabolism and how 5 is a biochemical function of pyridoxine. Third, short notes. First is a heparin structure and functions, lipoprotein lipase. Third, glycosylated hemoglobin HbA1c. Name the enzyme deficient in galactosemia. Role of keratin in fatty acid oxidation. 6, methylamine aciduria. 7 is uncoupler of oxidative phosphorylation. What are the essential fatty acid and name them. 9, active site of enzyme, and 10 is a Wilson disease. Second part, first, synthesis and mechanism of action of nitric oxide. This is repeated. Homocystinurias, hyperuricemias, normal anion gap with high anion gap metabolic acidosis, phase 2 detoxification, special product from glycine. 7, a 25-year-old physiotherapist concerned with his general practitioner because excessive sweating and was also concerned with his eyes seemed to have become more prominent and he had lost weight recently although his appetite was normal. He also complained palpitation on examination. His doctor observed this pulse rate was 100 per beat per minute at rest and he had a slightly enlarged thyroid gland, serum TSH less than 0.1 ml per unit and free T4 is a 3.2 and free T3 880. What is your diagnosis and justify? What is the cause of tachycardia in this condition? What is the explanation for the eye prominency in this condition? You have to write a thyroid function test and thyroid related disorder. Electrophoresis, 9, antioxidant, and 10 is a 42-year-old male was diagnosed with poorly differentiated adenocarcinoma. Family counseling revealed that the proband have family members with colorectal cancer diagnosed before 45 years of age. Hence, all family members were counseled that has been ruled to have been cause of defect of D repair, and all the family members older than 25 should go under the regular colonoscopic examination. What are the different D repair mechanism? Which repair defect cause the hereditary non-polyposis colon cancer? Describe in detail about the repair mechanism. You can download this paper from firstranker.com. January 2023, paper 1. Essay question: 4-year-old girl brought to the OPD for not being able to walk properly. On examination, she had a bow legs, thick wrist, dental caries. Her weight 8 kg and weight 8 kg and height 72 cm. Where elbow 3rd percentile for age, below the 3rd percentile for age. X-ray shows cupping and widening of metaphyseal end of bone, poor bone mineralization. Lab investigation shows serum calcium 8.5, serum phosphorus 3, serum alkaline phosphate is 924, serum 25 OH, vitamin D 12. What is your provisional diagnosis? Write the daily requirement of sources and deficient nutrient in the above condition and its main function. What are the details about the deficiency manifestation in children and adults? What are the cause of this disease? You have to write about the vitamin D. Explain the steps of beta oxidation in palmitic acid and its energetics. Add a note on alpha and beta oxidation disorders. Write a short notes on diagnostic criteria for diabetes mellitus and laboratory investigation in diabetes mellitus. Molecular basis of clinical features of sickle cell anemia and thalassemia. Passive transport mechanism. A 4-month-old child was brought to this history of vomiting, feeding difficulty and failure to thrive along the development delay. The child was born to full-term normal delivery, birth weight 3 kg and exclusive breastfeeding. The child also had suffered from the severe prolonged neonatal jaundice. The child now weighed for 4 kg. On examination, he had a hepatomegaly with bilateral cataract. What is your diagnosis? What is the biochemical defect? What is the biochemical test for reducing the sugar? What are the non-carbohydrate reducing the substance in urine? What is the treatment for this disease? 5th, metabolism of LDA with a clinical importance. Protein energy malnutrition, functions of prostaglandins, glycogen storage disorder. Classify enzyme with examples. Write a short notes on metabolic syndrome. March 2023, paper 1st. Essay question: 20-year-old woman who recently began taking birth control pills present to the emergency room with a cramping, abdominal pain, anxiety, paranoia and hallucination. Surgical evaluation including the ultrasound and computed tomography scan failed to demonstrate an acute abdominal process. And urine analysis reveals increase in urine ALA and PBG. What is your probable diagnosis? Which enzyme deficiency leads to this condition? Explain in detail of metabolic pathway that is the defect in this patient. What is the biochemical basis of these clinical features? Give reason for the development of symptoms after taking the birth control pills. How are the dietary lipids digested and absorbed? Explain how lipids are transported in plasma. Second question. Say part 2. First is a chemoosmotic therapy of oxidative phosphorylation, polyvinyl pathway and importance of pathogenesis and complications of diabetes mellitus. Third is a competitive inhibition of enzyme activity. Fourth is a 10-year-old boy had difficulty in vision at night. However, his vision was quite normal during daytime except when he entered the dimly little room. On investigation, his plasma retinol levels were found at a low. Suggest the probable diagnosis which nutrient deficiency caused the disease. Enumerate any 4 functions of nutrient. Write a notes on world's usual cycle. Biological value of proteins. 6th, enumerate the compound derived from the cholesterol and mention their biochemical function. Why is the Krebs cycle is anabolic in nature? Role of vitamin and glucogen in regulation of glycogen metabolism. Glycogen storage disorder. Structure and functions of mitochondria. This is also repeated question. March 2023, Paper 2 essay question. A 6-year-old boy present with periodic aggressive behavior. His urinary LA is unelevated on examination. He is eccentric, ecteric, mild hepatomegaly is observed. Blood examination revealed massive elevation of AFA, AFP, HPLC, and tandem mass. Supplementary examination revealed first is acid. Define the glucogenesis. What are the precursors of glucogenesis? Write overview pathway of glucogenesis with the key enzymes. Second is a 9-year-old presented with a muscle pain, cramps, tingling of hands and feet, and recurrent carpopedal spasm. She is a strict vegetarian, not taking milk and milk product. On general examination, she is a normal. On investigation, serum calcium is 6.5. What is the probable diagnosis? What are the normal serum calcium level? Explain the hemostasis of calcium in the blood. This is a repeated question. Vitamin D. Write short notes on balanced diet, amphipholic nature of Krebs cycle, physiological role of deficiency manifesting riboflavin. How will we reveal the increased blood sugar level at the patient and need of medication? Structure of mitochondria. This is repeated. Types of enzyme inhibition with suitable exam. Reaction and regulation glycogenesis. Galactosemia. Clinical importance of liver enzyme. Hemolytic disease of newborn. September 2020-24. Paper 2. First is explain how mRNA synthesis in the cytoplasm and is translated into protein with a suitable diagram. Add a note on post-transitional modification. Second, explain how phenylalanine is both ketogenic and glucogenic amino acid. Add a note on inborn errors associated with phenylalanine. Write a note on following hearts of disease. Secondary aciduria. How does the supplementation of vitamin B6, B12 and folic acid help in the management of homocystinuria? Second is a short note on DNA repair system, which is defective in heredity, non-polycystic colon cancer, mechanism action, methotrexate and acetaminogen D as an anti-cancer drug. Repeated question. A 5-year-old male child with uneventful birth history was brought to with a chief complaint of self-injurious behavior, irritability, emotional liability for the past 2 years. From the age of 3 years, he started biting his lips, tongues, banging his head over the wall, scratching his face, self-mutilation. Development history revealed delay milestones. Serum uric acid was 9.5. What is your probable diagnosis? Enumerate the biochemical basis of neurological manifestation in the disease. Discuss the salvage pathway of preurine synthesis. Explain the catabolism of tryptophan to serotonin, its clinical feature. Mention 5 tumor markers with diagnostic importance. What are the types of gene therapy? Give example of any 3 diseases for the gene therapy and his beneficial effect. 7 is a polymer chain reaction. This is also PCR. Repeated question. How will we explain the patient that his blood cholesterol level are high? What is the quality control? Explain types of quality control. Interpret the following liver function tests: total bilirubin, direct bilirubin, alkaline phosphatase, early stage and stool sample. What is the probable diagnosis? Mentioning possible cause of above condition. Substantiate the reasons for increased conjugated fraction of bilirubin. GUIAIN 2024. Paper first. Clinical base. First is a 3-year-old male child presented with a blister on exposed area since the age of around 6 months. The blister used to heal with atrophic scar. Since early infancy, the mother had noticed the reddish color of urine. The child's mental and physical development had been normal. There was no family history of similar problem. On examination, the child's face was badly scared. There was a hypertrichosis on shoulder, arm and face. The teeth were coppery red color. Diagnosis: congenital erythropoietic porphyria was made. Name the enzyme defective in congenital erythropoietic porphyria. What is the biochemical basis of congenital erythropoietic porphyria presenting with erythrodentia, red teeth, and port wine urine, red urine? With ALA, PBG elevated in this condition, why? What are the difference between acute intermittent porphyria and congenital erythropoietic porphyria? What is or are the effect of lead poisoning in heme synthesis? Second question: child present with hypoglycemia, hypophosphatemia, jaundice, and hepatomegaly after the transition from mother milk to the infant foods. He is diagnosed with hereditary fructose intolerance. Name the enzyme that is defective in this condition. Describe in detail normal fructose metabolism. Why is the fructose is more lipogenic than glucose? Why does the fructose intolerance present with hypoglycemia and hyperphosphatemia? How did the clinician exclude the galactosemia in this child? What is the expected in bending test to perform the child urine and why? Write a short notes on 70-year-old newborn baby. 70 hours old newborn baby delivered normally was brought to the pediatric OPD. History of passing yellow color urine, yellowish discoloration, conjunctive and body skin. What are the investigations to confirm jaundice? Brief the clinical significance of enzyme and normal value in liver disease. Second, 6-month-old infant present with failure of 3 to base of deviation across the two major percentile and standardized growth curves despite normal feeds. His serum calcium was normal, phosphorus, vitamin D were low, alkaline phosphatase level ALP, parathyroid hormone PTH were very high, diagnosed with nutritional vitamin deficiency. This is repeated. What does the vitamin D deficiency cause elevated PTH and ALB? How will be vitamin D activated? How does the D regulated? Third is a 55-year-old alcoholic was brought to emergency department with his friend. During usual hangout at the local bar, he had passed out and they were unable to revive him. On admission, his blood glucose was low. What is the chronic alcoholism present with hypoglycemia? Alcohol is considered as a source of empty calorie and why? Fourth is the following early morning run 29-year-old men consume carbohydrate-rich South Indian breakfast. Which hormone will be released into the circulation in this person? What is the common allosteric regulator? Which regulated glycolysis and glucogenesis? Describe in detail with glucogenesis. We regulated with the help of tandem enzyme in this person and scenario. Glycogenesis. 56-year-old male with treated with statin reducing the blood cholesterol. 2 weeks after initial treatment presented with the muscle pain. What is the mechanism of action of statins? What are the byproducts of cholesterol synthesis? Mention 2 derivatives of cholesterol and how is the cholesterol synthesis regulated? What are the ways which can get the consent from the patient for blood sample collection and diagnosis? What are the ethical issues associated with the blood sample in clinical laboratory? 7. A 35-year-old male central obesity undergoes master health checkup. His abdominal ultrasound reveals grade 2 fatty liver. He blames it on high fatty diet prepared by his wife. The physician denies that he has the cause. Who does the dietary lipid cause and fatty liver changes? What are the lipotropic factors? Give example. What are the causes of fatty liver? Mention the biochemical basis of fatty liver in the cause. 8. Village health nurse instruct the mother to provide her child drink bed with a 6 level teaspoon of sugar and 1/2 level of teaspoon salt dissolved in water and clean water to rehydrate the child. What is the sugar included oral rehydration solution? What are the difference between the passive diffusion active transport? What is the facilitated passive diffusion and exam? ORS. In inspired Stuhler stole rocky body, 23-year-old male wants to build his muscle instructed by his trainer. He takes a sea rock eggs every day. After 2 months he was working out, suddenly passed out. His plasma glucose 60. After the treating him, the physician advised him to refrain from having raw eggs and warned him to raw eggs consumption cause the low glucose. What does the raw egg consumption cause low glucose? What are the products of odd chain fatty acid oxidation? What are the products odd chain fatty acid oxidation metabolism? 50-year-old male person with recent episode myocardial infarction was prescribed aspirin on antiplatelet drug by inhibiting the cyclooxygenase enzyme. What are the eicosanoids? Name of two of them. Mention their function. How does the aspirin act as an antiplatelet drug by inhibiting the cyclooxygenase? August 2020-24 paper first. Explain the metabolic rearrangement in diabetes mellitus. Write a note on 88 criteria for diagnosis of diabetes mellitus. 25-year-old man presented with a severe abdominal pain, nausea, vomiting, palpitation, hypertension. Patient hallucination, seizure. Had a similar attack in the past. She did not have photosensitivity. Urine was positive for probiluzin. What are probable diagnosis? Describe the pathway of heme synthesis and regulation. Why did the patient have not photosensitivity? Write short notes on importance of dietary fibers and a pleuritic role of Krebs cycle, physiological role of deficiency manifestation of iodine, source ID deficiency, vitamin B12, ATP synthesis, specific enzyme, glycogenesis reaction, cardiac biomarker, lactose intolerance, and describe the structure and function of nucleus with suitable illustration. August 2020-24 paper 2 essay question. Briefly explain the glomerular filtration glomerular function test of the kidney with a suitable clinical applicants. Add a note on immunological test on renal disease. Second, adolescent girl present with a subluxation of lens and mental retention. On examination, she is tall, thin, with elongated limbs. One of her sister has similar complaint. Her serum homocysteine level is 1,500. What is the probable diagnosis? What are the cause of types of that illness? What are the lab investigation? Part 2, marker of obstructive liver disease, microalbuminuria, respiratory regulation of plasma pH, generation of free radicals in our body, precipitation of proteins, alkatoproteinuria, orotic aciduria, cell cycle, drip the products derived from the glycine, and reverse transcription PCR. This is a repeated question. Thank you guys. Please like, share and comment and subscribe to my channel.